Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
To look at the anatomy of the services that we're discussing, the documentation that's required, and coding and reimbursement. We're going to look at arterial lines, central venous pressure catheters, pulmonary artery catheters, coronary sinus catheters, and then transesophageal echocardiography, or TEE. So in order to reach where we're going, we have to know where we're going. So those are where we're headed today. So if you're ready, we're going to get started. First of all, why is it even important? And I've mentioned some of this when I was just doing the little introduction there, but it's really important nowadays to, why are we going to compete in this race to get these things right? And basically compliance is the name of the game. And those of you that are working in active practices, I'm sure are aware of or may have even been involved in the different audit organizations that are out there these days. The RAC audits are kind of the new kids on the block, new in terms of only been around for a few years. But they seem to be really taking front stage and making a lot of noise in what they're doing. These are contractors that are paid on a what they find type basis. And so when they come in to audit your practice, they're going to look until they find something. So we have RAC auditors looking at our practices. We have CERT auditors. Those are the comprehensive error rate testing. The OIG, of course, has been around a long time, and they have an auditing branch in which they will come in, and they not only can fine you, but they can sanction you to take away your privilege of billing Medicare services, which can be really devastating for practices, particularly if you have a large Medicare component to your practice. The private payers have been watching this, and they are now jumping on board because they've seen all of the money that the government auditors have recouped for the United States. And so the private payers, Blue Shield, some of the other ones, United Healthcare, are getting their auditing arms up and ready, and so we could be hearing from them as well. And then you have the increased patient awareness. There's things on the bottom of the EOBs that instruct the patients, give them an 800 number to call and say, you know, I'm not so sure I got really billed correctly, or they're billing me for this and I don't remember it happening. And granted, they could be totally not really valid, but once you're brought to the attention of some of these auditing groups, it's very difficult to get out from under their microscope. So all of that is just to kind of give you increased motivation to get these things squared away and know what you're doing. And then, of course, there's always running the reimbursement maze. More and more, those of you that have been in this for a long time, like I have, know that things have become increasingly complex. I can remember when I first got into this line of work, it was, you know, you kind of wrote down what you did, you sent it in, and they sent you the money. Well, those were the good old days. It doesn't happen that way anymore. There's all kinds of hoops that we have to jump through. We have limited payment policies from both government payers as well as some of the private payers. They're not only limiting what they will pay for, but how much they'll pay, and they're making it much more complex to submit your services. So not only is it important for compliance, but it's also important for our reimbursement, our pocketbooks. So the winner in the race to do this knows and follows the rules of the race. And our rule book basically is our Medicare Carriers Manual, our National Correct Coding Initiative, our private payer policies, and with the advent of the Internet, we have no excuses anymore where we can say, well, we really didn't know, we didn't understand. There are so many things out there to give us the instructions from both government workers, government programs, and our private payers that they will no longer take an excuse that we were ignorant or we did not know what the rules were. So specifically in terms of invasive monitoring lines, more than $75 million are paid out by Medicare yearly for that service.
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.